My name is Kemal Erkan. I'm the chairman of American Surgery Center, and I have Dr. Isaias Irgau with me, our president for CREAS. I was trying to get our nurses on for the last couple weeks, but then they were busy, and then we had technical issues, and today is that day. So I'm going to ask them to join us from directly from our surgery center. So you guys are all in one screen, so great. So, but we're vaccinated, and outside of this live session, we have our masks on, right? So I know you guys are doing a great job there. So, well, first, thank you for joining us. I know you guys are, today was an exception perhaps with our schedule. So we were done early because I was trying to get one from the PreOp, one from the OR, and one from the PACU, just to give us your perspective of the patients and how is it that our patients are so happy. So I'm going to start with Jessica, but let me actually just bring my PowerPoint so then.
No, pre-operation, okay.
So Jessica Gunkel, actually her mom was on a live session with me just 10-15 minutes ago, Donna Gunkel, and I told her the same thing. So Jessica has been with us several years now, and she is mainly in the pre-op. And we have Ashley Hansen, similar to Jessica, but she started even before at United Medical while she was she was at University of Delaware, a Delaware nursing program. And Ashley, it's been how many years now?
Since United Medical, almost 9 years.
And Ashley's only 17, so just think about like we've. And then we have Wendy Roll, and Wendy has been with us since the beginning of our time of the takeover at American Surgery Center, and she's in the post-op area, but she started there even before, right, Wendy?
2015. Yeah, about 5 years, a little more than 5 years probably.
Yeah. So it's been now 6-7 years with you as well. So what's the key for us to make our patients happy, and what you do personally from your side to make them comfortable? Because each part, like from the pre-op side, so Jessica, we can maybe start with you. So by the time patient is with you, they are fully aware of what's happening, fully awake, right? So they know exactly what's going on. So how do you do this so well, and what's most important? What do you see with patients that makes them more comfortable from your side?
So, especially if they're bariatric patients, sometimes when they come in, they're the only patient in the prep area, so they get our undivided attention. We all obviously wear our name tags, so we push the names on and let them know who we are. I think that what pre-op does is we kind of set them up so they already kind of know what to expect from the time they walk in. We tell them, everything that we're going to do for them in the prep area. We tell them a little bit about surgery, who's going to come see them before they go back, and then go over the goals again that they want to meet before they leave in the recovery area. We also push the warm blankets, which is always a hit for the patient.
But the process of the patient going through all the different clearances and getting to the final day of the surgery is a big day. And I know that even in the check-in area with our business office team, just to make them comfortable is important. And I know by the time they're in the pre-op, there's no going back. So they have to really trust you fully. And I know that you are in the pre-op, you are a big part of it. But when the patient is in the OR, it's already kind of like, actually you kind of lose the advantage of patient being awake, or maybe you use that as an advantage. So like, what's the interaction that you have with the patients at that time?
So for me, I introduce myself in the pre-op area before going to the OR, do my own little interview with them, and I always stress make sure they don't have any questions before they're sedated while they're still, conscious, and not groggy, and just make sure those things are covered before they get any medication. Jess and Ginny, the pre-op girls, do such a good job before I even get there. Usually they don't have any questions. And then when we bring them into the OR, I like to let them know everything I'm doing as far as putting a little strap on, a blanket, a blood pressure cuff, anything at all. I just like to let them know what I'm doing, because I know it can be overwhelming laying on a table, staring at the ceiling, wondering what's going to happen next. And my big thing is I always hold my patients' hands. Hopefully they like it. And I've wiped a couple tears a couple times, and I always tell them sweet dreams as they're drifting off. So.
When I was learning my way in the surgery center in the 2015 timeframe, so everything was new. Now, of course, from the practice side, we have experience, but now I have Dr. Irgau, who was so patient with me and explaining everything. We were going through the process, and then I realized how important PACU area also was. So I was thinking, okay, the patient was ready, patient is done with the OR, and now they should be okay. But I think the recovery is another big factor for patients' experience, because that's also what they remember. So Wendy, you are on that side for us. So what would you like to tell us?
Well, when the patients are done the procedure, they call out to the OR, from the OR, to let us know that they're coming, to make sure that we're ready, which we're already anticipating their arrival. We have everything set up, we're prepared in that way. And then we get report from the anesthesiologist first when they first come out, and then of course the OR nurse, so it's typically Ashley or somebody else, but they go through basically everything that they want us to know, as far as like incisions, how well the patient tolerated the procedure, what the vital signs were, and of course all the medications that they received in the OR at the time, so that we know what's on board. If there was any type of issue at all, we're always prepared to handle that from the beginning.
So what's the most important part from the recovery time? Is that like the first 30 minutes, first hour for our bariatric patients?
Well, when they first come out, they're typically pretty sedated, since it's general anesthesia. So for the most part, a lot of patients take, a good 45 minutes or so, maybe an hour, to kind of sleep that off. So that first hour or so, we don't rush them to wake up. We let them, wake up on their own. And the whole time we're monitoring their vital signs, have everything going that's supposed to be going, the fluids, the PCV boots are on to prevent them from getting any type of clotting. We monitor their belly, make sure their breathing's good, their belly looks good. And of course, if they're in any pain, they'll wake up and let us know, and then we can handle it right then and there. But there's no rush to wake them up, because we want them to just feel comfortable, let them sleep off the anesthesia. And when they wake up on their own is usually when we're ready to get them up and moving out of the bed. Usually it takes about an hour and a half or so after they come out of the procedure, sometimes a little less, sometimes a little more, it just depends. And the first thing we would do is sit them up to see how they're doing. If they're a little lightheaded or they don't feel well, we're not in a rush. We can move them just to the chair, and we'll just take it slow with them from that point on.
So after the operation in the PACU, they're spending average about like 6 to 8 hours, right?
Mm-hmm. Yeah, typically.
Now, one of the really important part also, after patients awake and they are recovering, when we are about to discharge and the patient instructions and what they have to do, if you can just tell us what that process for you is and what type of question maybe you are getting.
Okay. So typically, once they come out of the procedure and the procedure's done, I believe most of the surgeons usually call the family members to let them know the patient's done, just to give them a heads up how things went. If they haven't called them, sometimes we'll say, do you want us to call the husband or wife? We'll call them and just let them know the patient's doing well, she's out. When she wakes up, we'll give you a call and let you know how she's going. So typically, the PACU nurse is the one that's in touch with the family throughout the time in PACU. And we always welcome them to call in to check on their loved one at any time. It's not a problem, it's not a bother. But typically we'll call them at different times to say, now she's doing well, we think she's going to be ready to go at this time. We can kind of anticipate it pretty early on, how well they're doing, and if they're going to make their goals within the 6 hour mark, and we can kind of prepare the family that way.
Absolutely, absolutely. And our goal is to support our patients from different angles, from different levels, from the time that they come to our office to the time that they are ready for their surgery. Yep. And after their surgery. So we want to make sure that they have a pleasant experience and they feel like they're important, which they are. And we want to make sure they feel that. And one of the reasons that we do these sessions is to educate our patients, give them extra support, and also now bring our nurses and sharing their experiences just so that they understand that this is a teamwork, and without the team being all together, it's not going to be possible. So I really do also appreciate everything that you guys have done for us, for our patients, and we'll be doing a lot more in the near future.